Welcome to the Informed Pregnancy and Parenting Podcast. I'm your host, pregnancy-focused chiropractor, Dr. Elliot Berlin. My guest today is someone with an incredible story and unique perspective on pregnancy and parenting. She's an internal medicine physician and board member of the HER Foundation, Hyperemesis Education and Research. She's dedicated to helping others navigate the challenges of this pregnancy condition, Hyperemesis Gravidarum. From dreaming of becoming a doctor when she was just 3 years old to balancing a demanding medical career with her own deeply personal parenting journey, her experiences span the joys and complexities of growing a family. Along the way, she faced unexpected hurdles, including severe nausea and complications with her pregnancy and secondary infertility, leading to transformative decisions and lessons about care, advocacy, and resilience. Dr. Arielle Mitton, welcome back to the podcast.
Thank you for having me again. Nice to see you after so many years.
Yes, we had you originally because this is how it all went down. I interviewed Amy Schumer together with my wife in episode 154, and we promised her we would do some investigating about hyperemesis. She had a terrible case of hyperemesis, and you kindly came on to the podcast with two other doctors from the HER Foundation and really shared a lot of information about what we know about hyperemesis and, unfortunately, what we don't know about hyperemesis, and some of the ways to mitigate a pregnancy with hyperemesis, to realize that you even have it, to support people around you that have it. And like the others on that podcast, you had it as well. So you guys came on, that was episode 168. And then on episode 384, we had Charlotte Howden, who is the documentarian who made the film Sick, The Battle Against Hyperemesis Gravidarum, which is also streaming on Informed Pregnancy Plus. So it's been quite some time since I saw you last.
And there have been advances, actually, from one of the two other people that was on the show with me. She's done a lot of research that have actually, advanced the field of hyperemesis.
Yeah, so that's my first question. What's the latest?
So Marlene Fezzo discovered the GDF15 gene as the likely main cause. So basically in pregnancy, a rise in this GDF15 level is what is thought to cause the severe hyperemesis that some people get. So just like your body's not used to the level and it goes up rapidly. So there is some thought. Now, this is not like, I'm not saying people should go out and do this yet until there's more research, but there is some thought that if you increase your GDF15 level before pregnancy, if you know you have a history of hyperemesis, it maybe could help. So for example, metformin is thought to increase GDF15 levels. So some people are thinking, oh, what if we pre-treat with a medication like metformin? So I think we're on a pathway. I don't know what the ultimate results will be.
Is the issue that it goes down?
No, that it goes up.
It goes up. So if you pre-raise it, then you're sort of conditioning the body?
Yeah, exactly. Like your body's not shocked by the major increase that you have.
Is that a satiety related?
Yeah, I mean, it can cause sort of like the picture that you get in hyperemesis, just, like low appetite, cachexia.
Yeah, and your body just doesn't want anything else.
Yeah.
Okay, tell me about you and the work that you do.
You mean my professional work or my Hyperemesis Foundation work?
Both.
Okay, so professionally, I'm trained in internal medicine. I did a fellowship in geriatrics. And then I had my first child in residency and my second one in fellowship. So I decided after everything was done schedule-wise to work in urgent care because I liked the schedule better having kids at home. So I was doing urgent care when we last spoke. Now I'm actually working remotely, telemedicine from home. So I found a way to make, my physician world fit with my goal of parenting right now.
That's great.
Yeah, so it's been working out really well. And then I was also, at the time I spoke to you, I was a board member of the Hyperemesis Foundation because I was hit with really hard hyperemesis, very severe, with my second and third pregnancies. So debilitating that I couldn't get out of the bed to go pee. I lost over 20 pounds. To start, I weigh 120. So I was probably sub 100 pounds during pregnancies.
Wow.
Just felt like I was dying, up until 24 weeks. It was pretty hard, I would say, almost impossible that I can't believe I made it through those. But I had a really great care team for those ones. It kind of made me decide to look around what was out there. And when I saw Hyperemesis Foundation, I said, well, I have to reach out and see what I can do to help. So that's how I became involved with them.
I would just say for listeners who think that they may have hyperemesis or want to learn more about it, what does the foundation offer?
Oh, the Hyperemesis Foundation offers resources for both practitioners and patients, people that are experiencing hyperemesis, and family caregivers. So when you go onto our website, hyperemesis.org, you can find a plethora of resources. So if you're looking for yourself, there's treatment protocols that you can print out and take to your doctor to share with them. There's support groups for doctors. There's resources about how to treat properly, since it's not something that's well taught in medical school or residency, even OBGYN residency.
Right. So I have patients who went to the resources of the Her Foundation and then brought that to their doctor to be like, I don't think this
Yes,
is nausea and vomiting of pregnancy. This is something
exactly.
else. And that's how they were able to educate their doctor on what's going on.
Yes, that's true. And, personally, I was very lucky with my first two hyperemesis pregnancies that my doctor was, aggressive and supportive and all the things that a doctor should be, when dealing with the hyperemesis patient. But I learned the hard way that not all doctors are like that. And, I have a very sad story about what happened with my attempt to have a fourth and final pregnancy, which would have been my third hyperemesis pregnancy. And I was at a different hospital system and did not have a doctor who believed in hyperemesis and just didn't want to treat me, and ended up in a very terrible situation because of that.
And that's crazy because you are a doctor,
Yeah,
right?
and
Like if you have that problem, how does the rest of us get by?
that's exactly what I said. I said, I can't believe this is happening, currently in America, treatment-wise for hyperemesis, and this is just not right.
But to recap your first few pregnancies, you didn't have hyperemesis in the first one.
I had what I would call severe nausea, vomiting of pregnancy. So I lost about 6 pounds. There were limited foods I could eat, and I was still able to go to work. But, to me, it was starkly different than my second one, where like it hit me like a train and I couldn't get out of bed. I couldn't eat anything. Like I'd take one bite of yogurt or one sip of apple juice and I'd vomit 30 times afterwards. And just had no, like, you just have no energy because you can't take anything in. And so I couldn't stand up. I was weak. Yeah, everything was terrible.
Which is also just an important take-home lesson because you don't have it as bad in one pregnancy doesn't mean that you're not going to have full-blown hyperemesis in another pregnancy.
And for me, it seems to get worse each pregnancy.
Right. So that your second pregnancy, did it kick in early?
6 weeks.
Wow. I
That's like
mean,
how I knew I was pregnant. Oh, started vomiting and I can't get out of bed. I'm pregnant.
wow. And how did you treat it along the way? How did you care for it?
So, home health IV fluids, I was doing daily. Like, I know some guidelines will say, every or 3 times a week, but I was having to do at least 2 liters daily because I really was having no PO intake. So we were doing D5, half normal saline, and then doing, IV multivitamins. So I would get my thiamine and my folate and all those things that I was missing by not eating. I mean, I avoided getting a PICC line with that one. I just, had peripheral IVs that we would change all the time. But with my subsequent pregnancy, I ended up doing a catheter, like indwelling catheter, just because it was too much to change the IV so
It's a
often.
lot of poking
Yeah,
in poor
exactly.
veins.
Yeah.
Mm. So with that, it sounds like you're still miserable, but getting enough nutrition to sustain the pregnancy.
Yeah, the babies were healthy when they were born. I was surprised. They came out at 9 pounds. I was not expecting that.
Wow.
But, I was down to, like I said, like sub 100 pounds and I looked like a skeleton. So,
Wow. But it's incredible that your body was able to give them the nutrition to be that
I mean, I
robust.
think if it was in a different situation, like if, it was before modern medicine, I probably would have died. I mean, there were points where my potassium was, 2.7, like before I started the IV treatment. And, that can cause cardiac arrhythmias, heart problems. So I do think that it's only because of modern medicine that people can make it through, otherwise I think it's a deadly condition.
Right. For either you or the baby, or
Right,
potentially
exactly.
both.
Exactly.
In your third pregnancy, you had it again.
Yes. And I knew what to do this time and I had the same insurance. And so, we knew how to treat it basically.
Was it a planned pregnancy? Was it hard to say, I'm going to do this
Yeah.
again?
No, like I knew how much I suffered, but I also had a strong maternal desire, which was stronger than my suffering remembrance, if that makes sense.
No, it makes sense, but it's, again,
It's
it's
crazy.
incredible is the only thing that comes to mind. Like how strong really women are. I mean, when everything goes great, it's such a task. It's such a commitment. It's almost a sacrifice that you make to bring babies into the world when everything's just fine.
Yeah.
And then when something like this happens, it's magnified many times over. And
Well, and then in addition to just the medical treatment, something else I will say for somebody who is known to have hyperemesis and is, considering another pregnancy, Just as important is just like family or external support, because like I had two kids at the time and I knew I couldn't get out of bed, right? So beforehand, like I had my plan for like my mother-in-law, my mom, a babysitter, we had all those plans for like different time periods that people would be with the kids. So I think that's also something to consider too. It's not just the medical treatment, it's just, support for your life too.
All right, let's take a little break. When we come back, we'll find out what happened after the third pregnancy and how things really changed for the fourth. We'll be right back. Welcome back. We're talking to Dr. Arielle Mitton. Okay, so third baby, a little complication at the end.
Yes, at delivery.
Yeah, what happened?
So I had adherent placenta in my second pregnancy, or my first hyperemesis one, where the doctors had to reach in and remove the placenta, but it came out fine when they did that. But then with my next pregnancy, same thing happened, but it didn't come out after 30 minutes, so they were going to remove it manually. It started coming out in pieces, and I was losing a lot of blood. And over the course of that day and the next day in the hospital, I had to receive 6 units of blood total, so I had lost over half of my blood volume.
Wow.
I don't even remember what my blood pressure was, but my hemoglobin was, like around 6 or just less than 6. And so I think it was scarier for my husband than me, because he actually saw what was going on, where I was sort of out of it. And then on the third day, they had to do a DNC just to remove everything, make sure everything was gone.
Wow. So not a lot of bonding with your baby at that time, I imagine.
I actually still did. I mean, it happened so quickly, I will say, so I probably don't remember the times that I wasn't with her.
Well, that's for the best.
Yeah.
And is that something that you think is connected to hyperemesis or totally separate?
I wonder. That's the same question I have. I mean, there's no real data for that, but in both my pregnancies where the placenta didn't come out, those were the two hyperemesis pregnancies. And the one where it did come out was just my like normal kind of nausea, vomiting pregnancy. So I have to assume there's a connection for me personally, but I don't know if that would be, across the board for everyone.
After a pregnancy like that and a delivery like that, how long does it take you to recover?
Yeah, it took me probably about 2 years, honestly, to feel like fully strong again, where I could go for runs. I mean, I was recovering slowly every day. I would say with my pregnancy where I didn't lose blood, I was up and walking, the next day, walking around the neighborhood by day 3. But with this one, I remember like being in bed for the first 2 weeks, just kind of feeling a little bit weak from all the blood loss.
But yet you decided maybe we should do this again, a fourth time.
Yeah, I told you, I think I have too strong of a maternal dose or whatever hormone it is causing me to feel that way.
And so what happened when you started trying for your fourth?
Well, first I consulted with my trusted doctor and then an MFM specialist just because of my delivery history. I had said, I don't want to do this if I'm going to die. Like I did have some reason, I guess, reasonable thoughts there. But the MFM did clear me and gave me specific instructions for what I would do during pregnancy to monitor and during delivery, should the monitoring show the placenta was the same way again. And the worst case scenario, what they said would have been a C hysterectomy, so C-section with a hysterectomy, which I know is not easy, so it also can be a difficult surgery. But they made me feel confident enough that I didn't feel like I was being stupid getting pregnant and risking my life. So they said, we can handle this. We're a special center for this. We do this all the time. And then I tried to get pregnant and I didn't get pregnant for about a year. And it turned out I had adhesions from my DNC after delivery, so I had to have those removed. And then I got pregnant about 2 months later.
Is that the first time you struggled to get pregnant?
Yes. Like usually it would take me 1 month, 2 months.
And then after the adhesions were removed, it came fairly quick.
Yeah, it came pretty quickly. But we had changed jobs in between all this time, and so I had different insurance. And when I tried to make an appointment, I told the nurse on the phone about my history and I need an early appointment. They said, okay, you can have an appointment with the doctor at 12 weeks.
Oh, you were already having the hyperemesis symptoms?
Well, not yet, but I knew my history, so that's why I was trying to be proactive, right?
Yeah, and then their standard in that system is 12 weeks.
Yeah. It was an HMO system. They just, I guess didn't have the same staffing or something, but they said 12 weeks will get you in. I said, oh, that's not going to work for me.
Wow. And so what happened?
So I got predictably sick around 6 weeks and just kept getting sicker. And I had to go to their walk-in clinic, OBGYN walk-in clinic. I went there. And unfortunately, the doctor I saw that day didn't really believe I was as sick as I said I was. Like, I don't know, they didn't believe in hyperemesis or they thought I was faking it or something like that because it was me arguing with the doctor. I remember calling Kimber from the Hyperemesis Foundation on the phone, crying on the phone because his doctor wasn't believing me.
Wow, and this is recent
End of 2021, yeah, beginning 2022, exactly.
when we already have a lot of information about it and have been publicizing and publishing data. That's
I think, yeah,
crazy.
I mean, you have to be specifically looking for the hyperemesis data. I think it's not widely taught.
Right, but again, when you walk in and you're a medical doctor and you're
Hmm.
saying, I have this condition, and a medical doctor on the other side doesn't
Hmm.
listen to you, it's kind of mind-boggling. What I said at the beginning of the podcast is, how does someone who's not a medical person get listened to if you
Exactly.
can't? And so,
Well, I ended up going to the ER that time, which I never had to do with my other pregnancies because I was so supported and treated. I ended up going to the ER.
and did they treat you there?
They did. They did treat me there. And actually, I got steroids there, which I was nervous about because I know you're not supposed to give before 10 weeks, and I mean, it probably would have been fine, but I felt great from the steroids. But then the problem was when I got discharged, I went back to the care of that doctor and I didn't continue the steroids and I hit rock bottom quickly again after the steroids wore off.
Like, and then what happened after that?
So I was afraid of dying, right? Because like I wasn't getting my weekly labs, I wasn't getting, my treatment I'm supposed to get. And talking to that doctor, I ended up doing a termination. So I was scared I was going to leave my other kids motherless. I wasn't feeling supported, by my medical team, and I chose that route, I guess, because out of desperation. When I look back at it.
I guess two questions. First of all, it's not hypothetical. People die from hyperemesis.
Yes.
Mothers and babies die from hyperemesis when it's untreated, especially.
Yes.
And so for you to have that feeling, seemingly both your neocortex, where you have all this training, and your old limbic system telling you this is not going to end well,
Hmm.
and pushing you despite your incredible maternal drive to have babies.
I mean, I think because of that maternal drive, like the day after, I just mentally broke down.
How did that manifest?
Luckily, never experienced, depression in my life, but I think this was the first time I did. I was like, I couldn't get out of bed. And once I was physically getting better, it was like I wasn't connected. I felt like disconnected from my life. I felt disconnected from my kids. I just felt guilty about what had happened, even though, it was, not my fault. I was blaming myself for it. It took a lot of time to feel better.
How many weeks were you when you terminated?
I think about 8 weeks.
So you already saw heartbeat.
Yeah.
It's really hard.
Yeah, it was really hard. Yeah.
After your termination, it sounds like you weren't done having kids yet. So where do you go from
Well,
there?
exactly. So, I mean, in my head, I envisioned like that pregnancy was going to be my completing pregnancy, like my final one. I kind of envisioned my family with the 4 kids, and that was it. And so I think because of that, it made the termination extra hard on me, because I wasn't able to get to my goal. And I'm a driven person, right? Like I'm a goal-oriented person. So we actually ended up leaving Los Angeles at that time. It wasn't because of what happened, but that was probably a factor. We had other reasons to leave that we had been talking about for a few years. So maybe it was like the final straw type of thing. So we moved up to Washington State. And so I said, okay, now we're in a new location. Let's research, let's find really good doctors. And maybe we can, do this and complete our family and just make sure we have really good care before we get pregnant, since we learned a hard way from our experience. So I took my time. I met with some OBGYNs, found some that I really trusted and liked. And I said, okay, let's do this. And then again, wasn't getting pregnant, which wasn't unexpected because after my termination, I had unexplained uterine fluid. And when I was still in California, we were trying to work it up, but we couldn't figure out the cause of it. So I wasn't surprised that I wasn't getting pregnant when I started trying. So then I continued the workup here in Washington for this unexplained fluid and found a couple things. I found that I had new adenomyosis, which we think happened from the DNC, and then I had adhesions again.
What is adenomyosis?
So adenomyosis, they say it's like the sister of endometriosis, but instead of having growths, endometrial tissue outside of the uterus, you have it in your myometrium. So it just kind of invades deeper into the uterus.
Oh, wow. Does that prevent implantation?
It can. It's one of those things that if you ask a fertility doctor, they'll say it might not. Like a lot is not known about it, but it can.
Okay. And is that from previous uterine trauma?
We think so in my case. That's what we think it's from. Some women can have it just from having babies in the past too. So
Okay.
they usually have more mild cases, those women.
Got it. Okay.
Yeah.
So is there treatment to try to overcome that?
So I did do lots of treatment. So I mean, I had a hysteroscopy, laparoscopy to remove adhesions and just look for signs of endometriosis, which was not there. And then I had this really difficult medical treatment called Lupron. So basically, it just suppresses the estrogen because it's thought that adenomyosis and endometriosis feed off of estrogen. So estrogen worsens the disease and then, makes it harder to get pregnant. So the idea is you suppress estrogen and then it's supposed to suppress the disease, like shrink the disease.
Okay. Is that similar to the injections people do for IVF?
Well, it's an
So,
injection. It's a monthly injection.
okay, a monthly injection
But it's
too.
horrible side effects. It's like you're going through menopause. You get night sweats, you get bone pain, joint pain, headaches, insomnia.
Why do bad things happen to good people? Keeps running through my mind as you share your story.
Yeah, so it was definitely an interesting journey, I will say. Yeah, so my doctor asked me at one point. So I ended up seeing an REI doctor because my OBGYN and my minimally invasive surgeon said, I think you should see an REI doctor at this point.
That's a reproductive endocrinologist.
Exactly.
Okay. A specialist, a fertility specialist.
Yeah. Well, it was good. He was really caring and I felt listened to and heard. And he said to me, well, do you want to have a baby or do you want to be pregnant? Like that was his question to me.
Wow.
So it was a great question now that I look back. I think at the time I was shocked. But I mean, I said, well, obviously, I just want to complete my family with a baby. Like, why are you asking me this question type of thing, type of answer.
Yeah. So what was his recommendation?
Well, he recommended that I start looking into surrogacy. So, he didn't want to force it on me, like, you have to do surrogacy, but he was like, look, you have severe infertility, uterine factor infertility, you have severe hyperemesis, right? He's like, that alone is enough to just qualify you for surrogacy. You don't need to have all these other things, and, you have a postpartum hemorrhage. So he's like, you have 3 reasons that you should consider a surrogate.
Sure. And one of them to the point where you kind of had to terminate the pregnancy. So
Exactly.
who knows, like if you were able to get pregnant again, how that would go.
Exactly. So we did one round of making embryos, and I luckily got 7 good embryos. So I did, while I was looking for a surrogate, because that's a long, long process to find a surrogate, I did try to transfer, I think, 2 of them on myself without success.
Okay. I mean, so far to this point, crazy journey.
Yeah.
And I bet you're one of those people who just, when you see your kids and when they're screaming in the middle of the night, you're just super happy to hear those little screams and voices.
Yes, it's
Uh,
true. And even more so now. Yes.
yeah. So let's take a little break. When we come back, we will talk about what it was like to have your 4th baby by surrogate. We'll be right back. Welcome back. We're talking to my new hero, Dr. Arielle Mitton. Incredible. I say this sometimes that I did not appreciate either my mother or my wife nearly as much as I needed to until I started working with the pregnancy clientele.
It's never
And
too late.
yeah, I'm trying to make up for it. But again, that's just like with regular pregnancy, watching what women do. And when I talk to someone like you, who never gives up despite the intense pressure against you, resistance, I find it inspiring. So thank you. Last segment, we're going to talk about your 4th pregnancy. All has failed. You decided to have your 4th baby via surrogate. What's the process like of finding a surrogate?
Yeah, so I mean, the first was just us opening our minds to it, which maybe took a year or a year and a half, I think, to like fully. And then once we started it, there's different ways you can find a surrogate. You can either pay an agency and like you're stuck to that agency and they find you your surrogate, but you pay them up front a deposit. There's other agencies where it's like you don't pay us anything until we match you with somebody. So you can look at multiple agencies like that at the same time. Or you can, use social media and word of mouth to like have your friends, through their friends for you. And there's also like Facebook meeting groups where surrogate and intended parents can meet each other.
What did you do?
I did a combination of 2 and 3. So I would peruse the Facebook meeting groups and I also reached out to some of those agencies where they don't charge anything up front. Because I think we were still on the fence about it, We weren't like sure enough to like pay a deposit for it.
How did you find your surrogate?
Well, before I found her, this is, I think, part of the story about finding her. I was presented with about 6 or 7 other surrogates from those agencies, and I did Zoom interviews with them. And there was just either, something with their medical history or we didn't have that connection. I didn't know if I could trust them, so we didn't move forward with any of those people. And we kind of felt like we're about ready. So this was, maybe December 2023. We're like, I don't know if we should continue. I don't know. But then kind of took a break from it for a month or two. And then in end of November, I was just going to bed one night. I said, I'm just going to look one more time on that Facebook group to see what happens. So I was scrolling it and I go, oh, this ad looks interesting for this surrogate. It was posted by an agency about her. I said, I'm going to message them. I didn't hear back for 2 weeks. And then I got a response. So I said, oh, she's probably taken. She looked too good. And then I got a response saying, oh, she's available still. Do you want to talk to her on Zoom? Sorry, we were out of town and we missed your message. I said, yes, I would. So we know the date. So December 3rd, 2023, we get on Zoom. And, she's where you are right now on the top portion. I'm on the bottom. But we just look at each other. And our first response is we just start laughing. Like both of us at the same time, we just start laughing. It's because we look like sisters. I don't know. We had this like weird connection right away. And then we talked for 3 hours straight nonstop.
Had she ever done it before?
No. She had thought about it for years and never done it.
Wow. And, we've talked about this. We're going to tell the story quickly.
Yeah.
And it's going to leave me for sure thirsty for more details and probably the audience as well. But we're going to bring both of you back and do a much more in-depth episode about what it was like for both of you.
That will be the best story to tell.
I guess from the time you met, there's a lot of details to work out, even once you decide to do it. Mm-hmm. How long did it take to work out the details and start the process?
I think we were blessed in the fact that we're both open communicators. She also was in her early 40s, which I think, a lot of people overlooked her because of that. But she had a really clean OB history. And I think that maturity just, helped also move things along. But for us, I think it was probably quicker than most surrogate and independent parents. But we talked for 3 hours that first time and worked a lot of details out. And then over the month of December, we worked a lot more out. And I think we started to do our contract and we both knew what we wanted. We were telling the lawyers, this is what we want. And so we went through it pretty quickly. So I think maybe if the lawyers are fast, you can do it in 2 weeks, but maybe most lawyers probably do it in 4 to 6 weeks.
And when you moved forward with it, was it with an embryo you had already made?
Yes. So it is safer for all parties to make sure the intended parents have embryos first, right? Otherwise, it could waste people's time. Because what if you can't make embryos, right? Then you're paying someone and then you can't do anything. So yeah, we had embryos frozen first.
And did the first one take?
Yeah, we were very lucky.
Okay. That's the first sigh of relief, I suppose.
Mm-hmm. Yeah, I mean, you're always nervous the whole time, and she's nervous because it's not her baby and she wants everything to be perfect. But we had to, calm ourselves, calm each other, and just keep going forward.
What kind of involvement did you have through the pregnancy?
She's not in the same state as me. She's in Indiana, I'm in Washington State. But despite that, we either texted or phone called or FaceTimed every day. So, she wanted me to be as connected as I could. Every appointment she had, I was on FaceTime. And so I knew the doctor when I went to Indiana to delivery. I felt like I knew him and he knew me already. So she made me feel really connected.
What was it like sort of growing a baby not inside you?
So there's positives and negatives, and I'll go into more details next time we talk. But in a weird way, it helped me heal from all the trauma of what happened with my attempted fourth pregnancy and the loss that I had. It made me realize how much suffering I had done for my other babies that I had hyperemesis with, and then the scariness for my husband of delivery. And the fact that this time I was able to actually enjoy it and not, be in bed for 6 months and miss out on life for 6 months. And when I was going into the delivery room, my husband wasn't worried that it was the last time he was going to see me. So when I realized these things, it actually brought a lot of peace and helped me, I think, move forward.
For delivery, did she come to you or did you go to her?
I went to her. And it's usually done that way, because you're not supposed to travel when you're that pregnant.
Towards the end, yeah.
Yeah.
Did your husband go too?
So we'll touch on this in the other episode, but we had a unique situation during our surrogacy journey where escrow stole our money, which was unheard of. But because of that, we tried to keep costs low because we're having to do double payments now to the bank and to her. And so I went by myself and he stayed with our other kids.
Wow. Okay. And then delivery.
Delivery, yes. It was textbook perfect. I mean, this was her fifth delivery. She has 4 kids of her own. She's one of the 4 kids club.
Yes.
Yeah, so it was amazing. It was magical. I caught my baby because the doctor didn't make it in time. So the nurse and I caught the baby together.
Oh, wow. That's sweet.
Her friend was taking photos, so I have really great documentation of me holding my baby, just coming out of, the uterus, and just really special moments.
Did you breastfeed your other kids?
I did.
Were you able to produce milk for the fourth?
I'm glad you asked me. So right before we joined, I was here with my med box taking my domperidone and my other herbs and things. So I'm trying, and I'm making a little bit right now. Like there's something called an SNS where you like put a tube. Yeah. So I've been feeding her through there, and then I'll be pumping also when she's not feeding. And so I don't know exactly how much I make because I know she's getting some when I feed, but when I pump, I'm only getting about 1 ounce right now on each side. So I'm making a little, and I'm hoping it will increase.
So with the SNS, you're able to latch though,
Yes. Yeah.
and get all the benefits for both of you of latching, and you're
Yes.
making some milk, we know.
So I'm hoping it will increase, but we'll
She
see.
could be getting more from you than the pump does.
Exactly. Exactly.
How old is the baby now?
4 weeks. She was born December 17th.
Wow, congratulations.
Thank you.
It's a powerful story. Feels like a happy ending
Yes.
to me.
Yes.
Does your family feel complete now?
It does. I mean, she was definitely a missing piece. I think I'll always have some sadness over the fact that my body can't do what other people's bodies do and just have a normal pregnancy, you know? It's sad to know that I suffer so much during pregnancy and it kind of takes away choices from me. I think that's the hardest part to deal with.
I totally hear that, but I also think that your mind has proven capable to do what a lot of other people's minds can't do.
Which is what?
Power through, find a way. And again, even just the second hyperemesis pregnancy and going for a third hyperemesis pregnancy and then moving over to switch gears for the surrogacy. It's a lot of mental resilience and stamina.
And I think we're always harder on ourselves than we need to be because I remember a discussion with a friend who also did some work with the Hyperemesis Foundation, and I was saying, well, I failed. You know, I failed myself. You know, I didn't make it through that one. And she said, I don't think you failed. She said, you're a survivor. You've already done 2. You've completed 2. And, you know, now you're not giving up. You know, you're having a baby despite all the hurdles coming your way. So she said, I don't think you're a failure.
I couldn't agree more. Doc, we've talked about your work, not just your experience, but your work with the Hyperemesis Foundation, the HER Foundation. Where can we find that online?
Yeah, so just go to hyperemesis.org, and that's where you can find all the resources and contact us there.
I appreciate you joining me again and sharing your deeply personal and very inspiring story. And I look forward to having you back and digging really deep into what surrogacy was like, both for you and your surrogate in the coming episodes.
I can't wait for that. And I'll leave you guys with one little tidbit here about that. So we were told by the nurses that they've never seen a surrogate and intended parent so close after delivery.
Wow, there's a teaser.
Exactly.
At home, thanks for listening to the Informed Pregnancy Podcast. For more pregnancy and parenting information just like this, visit us online at informedpregnancy.com.
Doctor, give me the news. I got a whole lot of questions for you.